Hey, Startup DPC community. This is Dr. Paul Thomas with Plum Health DPC. I also started this thing called Startup DPC, and today I'm talking about crisis communication and how you can communicate with your audience to establish yourself as a trustworthy person, somebody who understands this coronavirus well, and somebody who can help others through it. We call this more or less professional branding or personal branding. You're really communicating about your character with your audience and helping them understand who you are and why you do what you do and why it's important. So right now there's a lot of panic in the air. People are really concerned about the coronavirus, and you can use this as an opportunity to really step up and improve your communication style with your patients and with your community. And it can help you to grow not only your personal brand, but also your business. So a lot of DPC doctors are concerned about what to do in this time, and this is one of the ways where you can give back to your community, communicate a clear message, and help people through this tough time. So what does that look like? It looks like speaking to the camera just like this, setting up your camera at eye level, making sure that you are looking directly at your audience and communicating clearly about your thoughts on this coronavirus. I would say that you want to stick to the facts and you want to stick to best practices. You really want to avoid blaming anyone or maybe speculating about the future. You can say, we're concerned that if the virus reaches this threshold, we may surpass the number of beds, so we don't have enough capacity for people. You can say things like that, but you want to avoid conjecture or guessing about what might or might not happen. So really stick to the facts, communicate clearly, and help people understand what's going on. Why are we using things like social distancing? Why is quarantine important during this time so we don't spread the virus? Some facts from other countries about the virus, etc. So that's really all I wanted to say, is that if you have a camera, if you have a medical assistant, my medical assistant's holding our camera right now. So if you have a couple things in your favor like good lighting, if you're able to communicate clearly, you can really help people through this process and thereby help your business survive during this tough time. So thanks so much for watching and have a great day.